Do you know what is the leading cause of death worldwide? If your mind is racing through various possibilities, allow me to stop you right there. It's heart disease, also known as cardiovascular disease, or CVD for short. This term encompasses a range of conditions that affect both the heart and blood vessels, claiming millions of lives each year across the globe. Now, heart disease isn't a one-size-fits-all type of condition. It comes in many forms, each with its unique characteristics. Some you might have heard of, like coronary artery disease, where plaque builds up and blocks the oxygen-rich blood heading to your heart. There's also the infamous heart attack, a result of blocked blood flow to the heart. Other types include heart failure, where the heart's pumping ability is weakened, arrhythmias, abnormal heart rhythms, valvular heart disease, damage to the heart's valves, congenital heart disease, defects present at birth, and peripheral artery disease, blockage of blood vessels outside the heart. Now that you know the different types of heart diseases, let's dive into the risk factors. What makes you more susceptible to developing heart disease? The answer lies in understanding the risk factors associated with this condition. These risk factors can be categorized into two main types: modifiable and non-modifiable. Modifiable risk factors are those that you have the power to change or control. For instance, high blood pressure and high cholesterol are two significant modifiable risk factors. Both conditions can be managed effectively through lifestyle changes, such as maintaining a healthy diet and regular exercise. Smoking is another modifiable risk factor. It's no secret that smoking is detrimental to your overall health, but it's particularly harmful to your heart. Quitting smoking can significantly reduce your risk of developing heart disease. Other modifiable risk factors include diabetes, obesity, physical inactivity, an unhealthy diet, and excessive alcohol consumption. Even stress can contribute to heart disease, making stress management an essential part of heart health. However, it's important to remember that while you can control these factors, doing so doesn't guarantee immunity from heart disease. There are also non-modifiable risk factors that can influence your susceptibility. Non-modifiable risk factors are those that cannot be changed or controlled. Age, for example, is a non-modifiable risk factor. As we age, our risk of developing heart disease increases. Similarly, family history of heart disease can also increase your risk. If your parents or siblings have heart disease, your likelihood of developing the condition is higher. Ethnicity and genetic predisposition are other non-modifiable risk factors. Some ethnic groups are more prone to heart disease due to genetic factors. While you can't change your genes or your ethnicity, knowing that you're at a higher risk can motivate you to pay more attention to the modifiable risk factors. Understanding these risk factors is a crucial step in preventing or managing heart disease effectively. It's about knowing what you can change, what you can't, and making the best decisions for your heart health based on that understanding. Knowing the risk factors is crucial, but recognizing the symptoms is equally important. How would you know if you or someone around you is suffering from a heart disease? Well, there are several telltale signs to look out for. Chest pain or discomfort, often described as a feeling of pressure, squeezing, or fullness, is one of the most common symptoms. This discomfort, known as angina, can also spread to the arms, neck, jaw, or back. Shortness of breath is another key symptom, which may occur with or without chest discomfort. Some people may experience fatigue or extreme tiredness even when they haven't exerted themselves physically. Others might report feeling weak, dizzy, or lightheaded. Nausea and excessive sweating are also common symptoms of heart disease. Heart palpitations, described as the sensation of a racing, fluttering, or irregular heartbeat, can be concerning as well. Lastly, swelling in the legs, ankles, or feet, known as edema, might indicate heart disease. If you notice any of these symptoms, it's time to get diagnosed. How is heart disease diagnosed? Well, the process can involve several steps and a variety of tests, each providing crucial information about the function and health of your heart. First, a doctor will perform a physical examination, checking your blood pressure and pulse, listening to your heart and lungs, and looking for signs of heart disease such as swelling in your legs or feet. This initial examination gives the doctor a general sense of your heart's condition and can point to potential issues that need further investigation. Next, a blood test may be ordered. Blood tests can reveal a wealth of information about your heart health, including levels of certain fats, cholesterol, sugar, and proteins in your blood. An abnormal result could indicate heart disease or an increased risk of developing it. Then we have the electrocardiogram, or ECG. This test records electrical signals as they travel through your heart. It can identify irregular rhythms or heartbeats, as well as damage to the heart muscle and tissue. An echocardiogram, on the other hand, uses sound waves to produce detailed images of your heart's structure and function. It can show how well your heart is pumping blood and whether it's enlarged or has thickened walls. A stress test is another important diagnostic tool. It measures how your heart responds to exertion. You'll walk on a treadmill or ride a stationary bike while hooked up to an ECG. If your heart struggles to keep up with the increased demand for oxygen, it could indicate coronary artery disease or other types of heart disease. In some cases, more invasive procedures may be necessary. Cardiac catheterization involves threading a thin tube into a blood vessel that leads to your heart. It can measure pressure and blood flow in the heart and can also be used to collect blood samples and check the arteries for blockages. Lastly, a coronary angiography may be performed. This test uses a special dye and X-rays to show the insides of your coronary arteries, helping to identify blockages that can lead to a heart attack. Diagnosis is the first step towards treatment. Let's now talk about how heart disease is managed. What can be done to treat heart disease? This is a question many people find themselves asking after a diagnosis. The answer is multifaceted, as management and treatment of heart disease depend on the specifics of the individual's condition. Let's start with lifestyle changes. A heart-healthy lifestyle can significantly impact the management of heart disease. This includes a balanced diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Regular exercise, ideally at least 30 minutes a day, 5 days a week, also plays a vital role. But remember, it's not just about physical health. Mental well-being is equally important, so incorporating stress-reducing activities like meditation or yoga can be beneficial. And of course, quitting smoking is crucial for those who do. Medications can also be a part of the treatment plan. These can include drugs to manage high blood pressure, high cholesterol, and diabetes. Medications can also be used to prevent blood clots, reduce the heart's workload, and control abnormal heart rhythms. In some cases, cardiac procedures may be necessary. These can include angioplasty, where a small balloon is inflated inside a narrowed or blocked artery to help widen it, or bypass surgery, where a graft is used to reroute blood around a blocked artery. Stent placement is another common procedure, where a small mesh tube is placed in an artery to keep it open. Implantable devices like pacemakers and defibrillators may also be used. Pacemakers help control abnormal heart rhythms, while defibrillators can detect and treat life-threatening arrhythmias. Finally, cardiac rehabilitation programs can be a crucial part of recovery and ongoing management. These programs provide education, counseling, and training to help individuals lead a heart-healthy lifestyle. In conclusion, the treatment and management of heart disease involve a combination of lifestyle changes, medications, procedures, and ongoing support. It's a comprehensive, individualized approach that aims to manage symptoms, slow or stop disease progression, and improve quality of life. While treatment is crucial, prevention is always better than cure. So let's now turn our attention to how we can prevent heart disease in the first place. How can you prevent heart disease, you might be asking? Well, prevention is better than cure, as they say, and this holds especially true for heart disease. The first step towards prevention is adopting a heart-healthy lifestyle. This includes maintaining a balanced diet, engaging in regular physical activity, and saying no to smoking and excessive alcohol consumption. Managing risk factors is equally crucial. If you have high blood pressure, high cholesterol, or diabetes, keeping these conditions under control can significantly lower your risk of heart disease. Regular medical checkups and screenings play a vital role in early detection, enabling timely intervention before the condition worsens. And let's not forget the importance of education. Understanding heart disease, its causes, symptoms, and treatments can empower you to make informed decisions about your health. Remember, your heart is in your hands. Take care of it. In conclusion, heart disease is a significant public health concern. It encompasses a wide variety of conditions that affect the heart and blood vessels, leading to widespread fatalities every year. The most common types of heart diseases include coronary artery disease, heart attack, heart failure, arrhythmias, valvular heart disease, congenital heart disease, and peripheral artery disease. Risk factors are divided into modifiable and non-modifiable ones, with the latter including age, family history, ethnicity, and genetic predisposition. Meanwhile, modifiable factors include lifestyle habits such as smoking, diet, and exercise. Symptoms vary but commonly include chest discomfort, shortness of breath, fatigue, and swelling in the legs, ankles, or feet. Diagnosis typically involves physical examinations, blood tests, and imaging studies. Treatment options range from lifestyle changes and medications to surgical procedures. Prevention is always better than cure, so adopting a heart-healthy lifestyle, managing risk factors, and having regular medical checkups are crucial. Knowledge is power. Understand heart disease, take proactive steps, and keep your heart healthy.